Hello, and welcome to the Doylestown Hospital Total Joint Program. During this presentation, we will review your options for anesthesia for your upcoming total hip or total knee replacement surgery. Also, we will discuss how your pain will be managed during and after your surgery. On the morning of your surgery, you will meet your anesthesiologist, who is the doctor who gives you anesthesia. During this time, the best type of anesthesia for you will be chosen based on your past medical history, the type of surgery that you are having, your options, and your surgeon's advice. Take this time to think of and ask any questions that you have. If you have had surgery before and something worked or did not work for you, please share this with the anesthesiologist on the morning of your surgery. There are two types of anesthesia options for your joint replacement surgery: general anesthesia and regional anesthesia. With general anesthesia, you will be unconscious and not feel any pain. Medicine is given to you through an IV or intravenous. You are asleep for the surgery. At the end of your surgery, the medicine is stopped so that you can wake up. You may have a sore throat, some nausea. You will be given medicine during your surgery to help with this, and you will be sleepy for about an hour afterwards. Regional anesthesia means that a part of your body will be numbed. For joint surgery, the goal is to numb the hips and legs. The two most common types of regional anesthesia used for joint surgery are 1. Spinal anesthesia. This is where a small needle is put into the lower back and into the spinal fluid. Then, a numbing medicine like Novocaine is placed to numb the lower body. 2. Epidural anesthesia. This is where a small needle is put into the lower back and into what is called the epidural space. This space is just outside of the spinal fluid. A tiny catheter, a small plastic tube, is placed into the epidural space. Numbing medicine can then be given through the catheter to numb the nerves in that area. The most common side effect for these two types of anesthesia is a spinal headache. This is rare. Sedatives are also given through your IV to keep you calm and relaxed during your surgery. Whatever type of anesthesia you choose, you will be closely and carefully watched to make sure that you are safe. Special monitors help keep track of your oxygen level, your heart rate, and your blood pressure. If at any time before surgery you have questions or concerns, you can contact the anesthesia department at 215-345-2207. Doylestown Hospital doctors use MPM, or a multimodal pain management, to keep you as comfortable as possible after your surgery with less side effects. At Doylestown Hospital, we know that control of your pain will help bring about a good joint replacement outcome. All of your doctors are on the same team to be sure your pain is controlled. MPM uses a mix of medicines so that lower amounts of each type of medicine can be given. This lessens the side effects of each medicine. MPM will help you be able to actively take part in therapy as early as on the day of surgery. This will allow you to move more quickly, lessen complications, and lead to a quicker return to home. Thank you for choosing the Orthopedic Institute of Doylestown Hospital for your joint replacement. We are committed to giving you the best care possible and look forward to being a part of your successful outcome. We wish you the best of luck with your surgery.